I just wanna hold you. Adiaya bad, Madam from Queen. I don't know what I feel do. Cause Adiaya bad. Adiaya bad. I'm going to drop your side.
We shall be talking to KENJI OBADIA, holder of a Master's in Public Health and a PhD Fellow in Global Infectious Diseases in the University of Hawaii, USA.
You are watching CMTV.
With me here in the studio today to talk about this disease, as we already said in the beginning, is Mr. KENJI OBADIA. You're welcome and thank you for honoring our invitation.
Thanks for inviting me, it's my pleasure.
We are so grateful you could make it to the program today. We know about your tight schedule and everything about you, but we are so happy that you could make it to the program.
Once more, thanks for inviting me, and also thanks for choosing such a very sensitive topic. And I want to say the topic for today is very timely, as you already said in the introductory part of the program.
That's quite right.
Yeah.
That's quite right. Okay, Mr. KENJI, you are holder in Masters in Public Health.
Yeah, that's right.
What does that mean, actually? Let the public know.
All
what
right.
does that mean?
You know, health, you can have health that you deal with human beings, like meeting patients in the hospital.
Yeah.
Yeah. Before going to a Master's in Public Health, I was more clinical. So public health, you are now health of the general population. Is opposed to clinical practice where I'm dealing with you one-on-one like a patient and a doctor.
Okay.
But with public health now is the general population. You come out with intervention measures like how to prevent the spread of certain diseases depending on your specialty.
All right.
Yeah, so I went into that because I have that passion for infectious diseases, and infectious disease control is one key thing that we really need in Africa and in Cameroon in particular. That's why I decided to do my specialty at the level of PhD in global infectious diseases, of which viruses are what I like working so much. I work with a related virus, which is dengue virus. We also call it hemorrhagic fever as Ebola virus, so they have certain things in common. So I love working with the viruses because they're very interesting.
You love working with viruses?
Oh yeah.
Like, so if you're sent to Liberia now, you will go?
Oh sure, I will go.
Right.
And if there is an outbreak in Cameroon and they need my services, I will go. I mean, every profession, you need to have some ethics, you need to have some conscience. The people, they need health personnel like us to try to contain the disease. So if the health personnel are running away to contain the disease, we will go and contain it. So at least our health personnel also have that moral obligation to see that the people are healthy.
All right, talking about Liberia, you going to Liberia for work and things like that. When we talk about Liberia, one thing comes to our mind, the Ebola virus.
That's true.
The Ebola virus. So please tell us, what exactly is the Ebola virus? What is it?
Yeah, it's a virus to begin with, and it is one of viruses. You know, viruses, you classify them as according to family. And so Ebola virus falls under the family Filoviridae. Under it, we also have Marburg virus.
These are big words.
Oh, not big words, like all medical jargons, as you also have your own jargons in journalism. So don't mind it, it's okay. So Ebola virus, all right, it has 5 species. So when we talk of Ebola virus, not like just one. There are 5 different types.
So species. Actually 5 different diseases.
Not the disease is called Ebola virus disease, no matter the species. But when there is an outbreak like this, you really want to know which species is actually causing that outbreak. So for the species, you have Zaire Ebola virus, you have Sudan Ebola virus, you have the Ruston Ebola virus, and you have the Bundibugyo Ebola virus, and you have the Thai forest Ebola virus. So those are the 5 different species. And the current outbreak, the species that is most incriminated for the current outbreak is the Zaire Ebola virus. And so far in Africa, most of the outbreaks have been caused by the Sudan Ebola virus, the Zaire Ebola virus, and the Bundibugyo Ebola virus. So the Ruston Ebola virus and the Thai forest Ebola virus have mostly been reported in the Philippines, in the People's Republic of China.
I will cut you short there. Talking about these different species, I heard about Zaire, Sudan.
Yes.
Are these names because of the fact that maybe they originated from Zaire and Sudan? Because at least I know of Zaire, I know of Sudan.
Yes.
So is it something, does it have something to do with the naming of the virus?
Yeah, I mean, there's always a scientific community that always try to come up with names for viruses. So yes, Sudan Ebola virus and Zaire Ebola virus, they were first identified in those respective countries.
All right.
And you know, Sudan now is what we call DRC. Right, if I'm right.
Yes.
I mean, sorry.
No,
Zaire. Zaire is what we call DRC.
Yeah.
And actually, do you know the name Ebola is the name of a river?
The river?
Yeah, it's the name of a river in Zaire. It was found in that river is found in the village where we had the first outbreak of the Zaire Ebola virus.
All right.
Yeah.
All right. Okay. You've said so much about the virus. Dear televiewers, you've heard him. You now know what the virus is all about. You now know that it's divided into 5 different species. But then we need to know, where did this virus come from? And when was the first time it was discovered in maybe humans, or because we've heard of the fact that it was discovered in animals, some people say it was in humans. So when was it discovered? Where did it come from? And in whom? Animals or humans?
Alright, I will not bring another jug. I hope it doesn't crack your head. Zoonotic infection.
So long as you break it down, we will get it.
It's okay.
Right.
So zoonotic infection means the probability of humans getting it from animals. So it is believed that the first case of Ebola, probably in most outbreaks, is as a result of a human getting it from an animal. The first case was detected in 1976. And there you had 2 simultaneous outbreaks that are called in Sudan and in Zaire. And the difference was just about 2 months apart.
Right.
And in those outbreaks, you had mortality rates of about 80% and 50% respectively of the different viruses. In the very first outbreak, roughly around 285 persons were infected with the virus. And the second outbreak, about 315 persons were infected in the virus. And these 2 outbreaks occurred simultaneously within 2 months. Now, I'm not always quick to say that was the very first case. That was the first case reported, but it could be that Ebola had been existing. It was there before, and you know, if you don't look for something, you will not find it. Yeah, you really need to look for it before you find it. So that was the first reported case, and so far, I went through to scan. There have been about 24 different outbreaks of Ebola.
Oh. Yeah,
24 different outbreaks of Ebola in Africa. Some of them have been really silent, like probably you just have just 5 cases. But I mean, those are still reported as outbreaks. And as I said, there are some species, 3 of those species are so common in Africa, and most of them have been incriminated in those outbreaks. Before the current outbreak, the last outbreak happened in 2012. So we are now having another outbreak in 2014.
That's 2 years,
yeah, 2 years
after the last outbreak. But in all what you've said, I picked out something of vital importance. Africa. You've not mentioned anything about the Western world.
Yeah.
Just Africa. Why? Why? Is it that we have animals only in Africa which can transmit the disease to the humans?
Well, that's a very tough question to answer. I mean, the demographics or the ecology of the 2 regions may have a role to play. Yeah, we have animals in Africa. There are also animals in Southeast Asia and other like. There have also been some little fossil infections in Philippines and in China and other like. So I think it's not only the issue of the animals, but human behavior also have a great role to play. You know, as Africans, we love bushmeat, right? Don't you like bushmeat?
I do.
Oh, yeah. So, if something is a zoonotic infection and we really have that passion to eat bushmeat, so it means that the hunter guys, they got a lot of work to do. They have to go to the bushes, catch the animals, and if the animal is infected, now the risk of the person being infected is there, and it brings it. Now, yeah, it's not only the issue of being infected. When you are infected, the capacity of the country to control the disease is also very, very important. Now, if you look at the current countries that are having the outbreak, Sierra Leone, Liberia, if you flash back, you realize one thing in common with them. They are just recovering from war. Okay. Now, when there is war in a country, the healthcare system of that country is diminished. What do I say? The capacity is reduced. Like when there is war, they bomb hospitals, some healthcare workers also die. So when a country is rebuilding, the healthcare system is also trying to rebuild. And in countries like Sierra Leone, where the healthcare system is just trying to rebuild, so if you have just 1 or 2 cases of Ebola virus, it can spread very easily because the capacity of the country to try to pick out cases very early is not there.
Most financial resources even had been
has been diminished. So it's not only about the financial resources. The financial resources is required. For example, healthcare workers, they need personal protective equipment to be able to attend to the patients. Now, it is not only financial but also the manpower. If you have 75 Ebola patients, you need at least close to 200 healthcare workers to attend to those 75 patients. So you can imagine, now you don't have that many healthcare workers to attend to those patients. So what happens is that some of those patients, they don't get the appropriate care that they need. They die. The intensive care units may not be so well equipped to handle those patients, and the hospitals may be overwhelmed to handle those patients.
Maybe non-existent, like you said.
Non-existent in some places. So what happens is that the patients that are there, they continue to spread it to others. So it really takes a lot to explain why it is so peculiar in Africa. There's a lot of reasons that I'm not sure I can exhaust all of them here.
All right, thank you very much for that clarification. Talking about the Ebola virus, another thing comes to mind. You talked about the fact that a hunter can get into the bush and then get contaminated from an animal maybe he hunted and gets back to the city to transmit it to others. How then does he transmit it to these people? How do other people get contaminated from the disease from one man?
All right. So now, the hunter gets to the bush, for example.
Yes.
It must be a hunter.
Yes.
Okay. The hunter gets to the bush and shoots the animal and probably becomes contaminated by the blood of the animal, an infected animal.
Right.
And mind you that you need to have probably a breakthrough for the virus to get in.
Like a wound?
A wound on the skin, through the mucous membranes and all those things. So the virus must have access. It is not airborne like you have tuberculosis.
So there must be contact?
Yeah, so there must be contact. So when the initial person has the contact with the animal, the person that comes into the community. Now, if that case is not picked out immediately, what happens is that this person is in the community. He will sneeze. The virus is present in bodily fluids of infected persons. Bodily fluid, meaning blood, semen, and all like sweat and all those things. Also depending on the viremia of that person, all right, the level of the virus in blood of that person as well. Also determine the quantity or the viral load in all this virus fluids. So you see that person can even contaminate a surface. And what happens is that another person comes on that surface. We are fond of touching things. And when we touch especially babies, even adults, come on. Even adults. And when we touch, we don't wash our hands regularly. Or even when we wash our hands, we always have this practice of somebody just brings a bowl. You just wash your hands inside. That's not hand washing. It's contaminating your hand.
And they send it to the next person.
They send it to the next person, so you understand. So you have the least abrasion, so that's how it spreads. When the person is infected, and the longer the virus is in that person, the higher the probability of that person to spread the virus to the entire community.
Okay. Okay.
And one thing is that Ebola virus disease mimics other infectious diseases, for example, malaria, for example, typhoid. So when this person presents with fever, or when this person has fever, most often we always think it's malaria.
It's malaria.
So now, what if it is Ebola virus? And most of us, when we have fever, we just stay at home.
And take paracetamol.
Or we go and find the next chemist shop and get some quinine and all the like. Yes. But meanwhile, it could be Ebola, So you see, that's the problem. It takes a lot. We need to educate the people as well on auto-medication. People go to school to be trained to become medical doctors. That is their role, to say you have this. But now, since most of our people in the Kache, or most of us, want to take the place of medical doctors or of nurses, we just want to, I have fever, or quinine. Now, see the problem. Ebola is coming. And it also presents as malaria. It also presents as if it is typhoid. Yes. Headache, joint pains, vomiting, and all the like. So that is how the transmission continues to go silently and unnoticed.
Okay, you talked about the first outbreaks in Zaire, in Sudan, about 300 cases, 200 cases in one episode.
Yeah.
What happened then that it could be contained? And right now we are seeing the Ebola virus going viral doing its thing, killing people day in, day out, but nothing is being done. What happened then that stops the virus? That cannot be done today to stop the virus.
Well, it's not like the present outbreak cannot be contained. It will be contained at one time. We pray so.
Okay.
But it will take some time. As I told you, there are a lot of factors that come in that we could use to explain why this particular one has spread so much. If you go right far to the 70s, my history knowledge will not be very, very strong. But I would think that at that time, the health capacity of those countries were very strong, that they could quickly pick out these cases and treat them promptly and isolate infected people and all the like. Now, it's not like they were not doing it now, but what I think, or in my own idea, what I think is that the health capacity of most of these countries are really down because they are just trying to recover from war and all the like. So that is why it is really, really posing a big problem for them to try to contain the virus now. And even with the help of international organizations and all the like, I really do hope that in due course or in some time to come, they'll be able to contain the virus. You see, even international NGOs like Medecins Sans Frontiers, even their personnel are already exhausted. They're already sending so much personnel in the field that it is really overwhelming for them also to handle at this particular point in time. And as days go by, traditional practices also have a role to play. The way you handle corpses in most of these countries, because a majority of the transmission have been attributed to the way the people handle corpses, some traditional practices. So you see that now things are becoming a little bit modernized, and the government of those countries are trying to discourage those practices. So that's why you see somebody dies from Ebola virus disease, the government of those affected countries will try to put in measures so that the patient is buried or incinerated in such a way that it doesn't pose any pending threat to the next person. So to actually do a retrospective comparison on what was done then, that is not done now, even though I was not there then, I cannot really give you a clear-cut answer that this is what is missing for now. But all I will say is the previous reasons that I've given you, all right? Lack of healthcare personnel at this time, and the capacity, the financial resources also of these countries to deal with this. Yeah, they are not there.
Talking about containing the virus, we would also want to know, is there actually a cure for the virus? Is there a treatment, a vaccine, or something that can be used in order to stop this virus from killing the people it is killing out there?
All right, there is no cure. You know, there are two things. There's difference between cure and treatment. There is no cure. Treatments can be given, all right, mostly fluid therapy. All right, since people vomit a lot and you can't dehydrated, oral rehydration and all of that. So those are just supportive care that's given to the patient. There is no cure, there's no licensed vaccine, there is no licensed drug that can be used to treat patients. But the good news is that now the FDA have precipitated clinical trials for a potential drug that could be used to treat Ebola. It was given to 2 US citizens, as you must have read in the news, and plans are being made because, I mean, even when I heard that this trial drug was given to 2 US citizens, I mean, I felt so bad that, you know, this is really affecting Africa, and if they should have a trial drug, why don't you give it to the people that is really affecting them? But the good news is that at least that there are about 1,000 drugs that have been promised to be sent to Africa, so that it could be given to the patient. It's still in the trial phase, and as you know, in clinical trial, you have different phases of the clinical trial. So I do also understand the stand of FDA as well. You need to also make sure that the drug is safe. It's not just that there is a drug, give me. I mean, if they give you the drug and you die because of the side effect of the drug, it doesn't make any sense, right? You better just be with the virus and you live a little bit longer. So those are some little cautions that they are putting in place, and we do hope that probably in due course we are going to have a drug that can actually cure the virus or treat the virus.
Hey, Mr. Kenji, talking about this virus, while it's out there doing its job, we have been receiving so many funny texts in our phones talking about the fact that we should eat bitter cola in order to prevent the virus. We should stop eating pork meat because if you eat pork meat, you're going to get Ebola. How true are these facts? How factual are they? as a health personnel, you should be able to tell us, should we eat bitter? Should I run away from this scene right now and go get my bitter cola?
That's a very interesting question. I mean, I also got that text message. For example, the Ebola virus has reached Bamenda. So apart from eating bitter cola, everyone is called upon to bathe with salt and water and also drink salt and water. Please send the message to your friends. This is barbaric. I mean, I don't know why people will just sit and try to derail the mentality of persons. There is no scientific evidence linking bitter cola as eating bitter cola as a preventive measure for Ebola.
So you never studied anything like that?
There is nothing like that, and it's not good when people just type text messages and they begin to spread false information. Come to think of it, do you know the best way if you want to prevent Ebola? Wash your hands. So when you finish this program, just go wash your hands.
With soap?
Wash your hands with soap and water. Okay. And when you want to wash your hands, don't do it as we do for ceremonies, right? Put a running tap, or another person should be pouring the water. You wash it. And I attended a 1-hour lecture just on hand washing. You know the best way to know if your hands are clean? When you begin to wash your hands, sing the happy birthday song. Happy birthday to me. Alright? When you go through it and you're washing with soap and water, there you can end and you dry your hand. And you can also use hand sanitizers. These are the messages that people should spread. People should not go spreading false information on bitter cola. There is no evidence at all anywhere linking bitter cola and preventing Ebola. Now, what is the aftermath of this? When you give people such education, like the price of bitter cola went up. I used to buy bitter cola, not because of Ebola anyway, because I like eating it. I used to buy 25 francs in Yaoundé. But now the guy came and he's selling for 50 francs because the demand have increased.
High, yes.
So when you tell people begin now to consume bitter cola, they know that they are safe. And what will happen is that they will not indulge in funny practices like touching all sorts of surfaces, eating whatever they want. They'll forget all those things because they think the bitter cola is acting like a vaccine for them. No, please don't think eating bitter cola is going to prevent you from getting Ebola, please. And those spreading those information, it is not good. Please spread the correct information. Now, come to think of it, regarding pig
pork meat,
or consuming pork meat. Yeah, I'm going to tell you this. I tell you there are 5 different species of the virus.
Yes.
One of those species have been shown to be able to infect pigs, the resistant Ebola virus.
Okay.
But now, the virus have not been shown to be present in Africa. The resistant Ebola virus has been shown to be present in the Philippines and the People's Republic of China. And even though it has been shown to be present there, there is a probability of human infection in those places. But till now, no human death have been reported from that particular virus.
Okay.
Yes, Ebola virus can infect pig. As I said, there are 5 species. One of them can infect pig and monkey farms and all like. But that species have been documented in the Philippines and in the People's Republic of China.
And not in Africa.
Not in Africa, but it could still be there. Anyway, if you have to stay at pig, it now begins with the people who are the poultry farmers. How do you slaughter the pigs? How do you slaughter the monkeys? Because monkeys also have been shown to transmit it. But now, there's also what is called the reservoir. The reservoir is not monkey, the reservoir is bat. You know bat, right?
Fruit bats.
Oh yeah, fruit bats. That's the reservoir.
Yeah.
So there's always a probability that the fruit bats will like to go where pigs are being reared.
Okay.
And probably are transmitted to the pigs. So now, the person handling the domestic animal, the pig that's slaughtering it, the person needs to ensure that he puts on gloves, especially in this period of outbreak. Not in Africa anywhere, because this is like Philippines and all that. Put on gloves to prevent transmission to you. And if you really want to continue eating your pig or your dog, pork, because pig is the animal, right?
Yes.
Cook it. Alright? Cook it. Boil it well to the right temperature. And you are good.
So the virus actually dies?
Definitely. Viruses do die. As human beings also die.
Okay.
Yeah, there's what you call disinfection and all the like. There are some disinfectants that will be able to take care of the virus. And high temperature also will be able to kill the virus if they are present in the pig.
Once I cook my pork meat well...
Not only pork meat. Monkeys, alright?
all
need
the
to make sure
bushmeat,
that you cook
I
it
love
well.
eating,
Yeah,
yes.
all the bushmeat you love
Make sure-
eating. If you really want to eat it, make sure that you cook it very, very well.
Okay.
But to be very safe, especially, I don't want to talk much on domestic animals because I don't think that's a very big problem for us now in Africa, the pigs. I don't think that's a big problem for us now. But the wild animals like the monkeys, the chimpanzees and all the like, it is very, very important that most especially in the affected places, people should try to stay away from them as much as possible. But even if you really must eat it, please make sure that it is well cooked to the right temperature. Yeah.
And in killing it, like you said, you put on gloves to make sure that you don't get contaminated before the cooking process.
Yeah, I mean those who are slaughtering the animals, alright, you make sure that you wear personal protective equipment.
Okay.
Yeah, probably even respiratory hygiene is also good, or putting on the respiratory mask as well is also good to prevent all those possible contamination because the virus is found in the blood of the pig that you're about to slaughter and also other secretions. I'm going to tell you something, I don't mean this to frighten anybody, but I mean research have shown that men who recover from Ebola virus still have the probability of passing out the virus in semen even after 2 weeks that they have recovered.
So even after recovering,
Even after
they can still pass it
recovery,
to
yeah,
another
they can
person.
still the
Or
virus.
get reinfected themselves.
No, not like when you say you're recovered, it doesn't mean you are. Well, I don't want to talk much about reinfection and all those things, but what I want to talk more is on the issue of spread. Yeah, a man who gets the virus and recovers from the virus, because when you recover from the virus, you have higher antibody titer that may tend to prevent you from getting infected just a little bit, but the evidence is still a little bit flashy, not very, very clear. But that person can still pass out the virus in semen for up to 2 weeks after recovery. So you see that all those things also compound. If he can still pass it in semen and probably he has sex and there's probably a cut or a breakthrough with a partner, there's a probability of infection as well. So those are some of the things. So, yeah.
Alright. What I would retain from all of that is that I should make sure I wash my hands. I should make sure I don't listen to false announcements. That's how I'll call them. False announcements from some people who sit in their houses and tell us that bitter cola can cure or prevent the Ebola virus.
And please don't also bathe with salt and water.
Yes.
You may be causing another trouble to yourself or drinking salt and water. You know, my neighbor ran and, no, not my neighbor, one of my students, I taught him, I mean, that she told, when I was discussing with her, she told me that I just took a bath with salt and water. And I'm saying, I mean, even you, I mean, how do you be fooled up to this extent of bathing with salt and water? How does that prevent you? I mean, there are certain things that we should read. Look, when messages come to your phone, it's just like a general education. I mean, network providers like MTN, Orange, without any publicity, please, I mean, they have that moral obligation to send out certain key information that comes from the Ministry of Health. I think those are some kind of information that you should readily believe when you see them. Because if these network providers are sending, if they are sending a message on behalf of the Ministry of Health, then that message is valid. It's the same like for polio campaign. I'm sure you got a text that vaccinate your children, Minister de Santé. I think our ministry, they are doing quite a lot to help us, and they are doing quite a lot to sensitize us. And if there is any pending danger, or if Ebola is reported, I think our news channels will tell us. CMTV will tell us, and the other news channels will tell us. Yes. Not people just sitting. At times, at times I sit and I ask, do Cameroonians really pray that Ebola should come? Because every day, somebody said it is reported in La Cantini. You went to the director in La Cantini, there's no Ebola there. So I don't know if we really want Ebola to come. Please, let's instead pray against Ebola. Because I tell you, it is a very, very devastating kind of disease that you will not really want to have.
Yeah. Okay, Mr. KENJI, we've been talking a lot about the Ebola virus. I would like to know, and I'm certain the viewers would also like to know, how does this disease kill? What's the difference between the way it kills and the way malaria kills, or other diseases it mimics? Because you're talking about the fact that it mimics a lot of diseases and infections.
Ebola virus, in the first place, an RNA virus. HIV is also an RNA virus. RNA viruses, they are known to cause very acute illnesses. And most often, for example, Ebola in particular, the mortality rate is very, very high, 90% in most of the species. It means that if 100 people have the disease, 90 of them will probably die, and about 10 of them are going to survive the disease. How it kills comparing to malaria, I mean, for malaria, the problem is mostly for children less than 5 years of age, because they don't yet have a strong, immune response. But as you grow older, you acquire some natural immunity against malaria. That's why you can even have mosquito bite today, but you don't fall sick, right? Because you acquire that immunity. Now, something like Ebola virus, the way it kills, without going much into the detailed immunology, one of the laboratory parameters is that you have low platelet counts. And on top of platelet is that component of blood that is responsible for your blood to clot, or if you have a cut, the wound should heal from. So it disturbs that coagulation cascade. That's why you have bleeding.
Incessant.
Yeah, you have bleeding from the orifices and all the time, and also internal bleeding. And internal bleeding is one of those things that you really don't want to have, because it's like driving you to your grave. And it doesn't end there. You have organ failure. For example, your liver, your kidneys, they also fail. So it is very, very accurate. It's just fast. All right. And one of my professors say, if Ebola virus does not leave you fast, it kills you fast. That's one thing. So the incubation period is approximately 2 to 21 days. That's the incubation period. Incubation period is that time when you become infected to when you begin to have the signs and symptoms of the disease. So it's between 2 to 21 days. And most often, people who are infected die within 2 weeks.
Which means when you get the virus within 2 to 21 days, you might not even know that it is the Ebola virus.
It is the Ebola virus, because it's still in that incubation phase. You're not yet really presenting with those clinical signs and symptoms that are typical of Ebola virus that can be used now to rule out other possible diseases. So as compared to malaria, malaria, the parasite goes destroy the red blood cells and all the like, but Ebola is not destroying the red blood cells, right? It is trying to, it just disturbs the coagulation cascade. That's why you have all this bleeding and all the like, organ failure, and that's why people die just so fast.
You talked about a 90% rate of death, which means 10% of the people who get infected with the disease can actually survive.
Yeah.
So are there any cases of someone or people who have survived the Ebola virus? We know about the fact that the Ebola outbreak was there in Zaire, in Sudan, and then maybe it stopped and came back after some time. So are there people then, or maybe now, who have survived the virus?
Oh yeah. If you look at the WHO statistics, you have pretty much over 2,000 cases that have been reported. Just close to that. I'm taking an overestimate. And out of those 2,000 cases that have been reported, the number of deaths is like probably 1,300 or 1,400. Means there are some people who have survived the virus, who have survived the disease. And what is typical with those who survive the disease is that it has been shown that they produce a lot of antibodies. Antibodies, it's like the army of your body that is responsible to fight any pathogen that's coming here. So they produce very high titer of antibodies. And experiments have been done wherein they try to get serum from those people who have that high titer antibody to see if they can take that serum and they inject it. All right, in other infected persons. Yeah, some research have shown promising, like probably 4 out of 10 people who probably got that serum may be a little bit protected, but the data is not yet very, very clear regarding that. But it is also promising. So when you are infected, you have that high antibody titer in you.
So there are actually some persons who can survive the disease.
Oh yeah.
Who can end up eradicating the disease from their system because of the fact that they have that high, we said, antibodies.
No, it's not because they have the high antibodies titer that they survive. When they survive,
Okay.
That is when they have the high antibody titer.
All right.
Yeah, because of that. It's not like they had the antibodies before.
Okay.
All right, having antibodies before is more like vaccine, right? For vaccine, they can decide to give you the antibodies to wait for the pathogen to come. So that's why the experimental trial where they try to get serum from these people who have been infected and they recover, all right, the antibody titer is high and they try to give it to some other person who probably is infected to see if the person can actually be protected.
I'm sure that with that information, some persons out there like myself are now more confident about the fact that a cure can actually be gotten, or maybe they're confident about the fact that they might be in the percentage that can survive.
Yeah, they might be in a percentage that can survive, but as the dogma always goes, prevention is better than cure. Yeah.
We've been hearing much about the disease in Liberia, in Sierra Leone, in Guinea. What are the chances that the disease can get into Cameroon? Because not long ago we heard about the fact that it was in Nigeria. About 8 or to 10 reported cases in Nigeria, and we know Nigeria is just a stone throw to Cameroon. So what are the chances that we can get the disease in Cameroon, and what is being done? Is there anything that's been done in Cameroon, for example, to be able to curb the disease if it gets into Cameroon?
Can Ebola get into Cameroon? Yes, it can get into Cameroon.
Okay.
Anywhere that you can have movement of people in and out of the borders, there's always that probability of having infectious diseases in those places. Now, up north, you have outbreak of cholera, which may be due to imported cases of refugees who are coming into the country. You also have outbreak of yellow fever and all the like. So when you have movements, Cameroon also is a good touristic site. We are trying to develop a touristic industry of our country. So that means we are friendly to the tourists and we let them come in. Central Africa is just next by to us. Come on. People can live there and get into Cameroon. So there's a high chance that it can get into Cameroon. But now, I think I also watched the Minister of Health during his press conference, trying to tell us about the measures that they are putting in place. Surveillance is very, very important. Surveillance meaning that you want to pick up the cases as soon as possible. Because when you pick up the cases, early case detection, when you pick up the cases early, you prevent spread to other people. Yeah, so he said they are putting some surveillance measures in place, even though he did not elaborate much on the surveillance measures. And that the government have tried to get some protective equipment for the healthcare personnel. I don't know if you talk of 100 of them or how many, and you saw the guy during the press conference who put on the white suit up and down. Yeah. So I think the ministry is trying to put in some measures so that if the virus comes, they can be able to contain it. But one thing about Ebola virus is the risk to healthcare personnel. Because if you look at the current outbreak, the number of healthcare personnel that have died is also alarming. So the healthcare personnel really need a lot of protective equipment. And talking of an entire country of Cameroon having barely a few hundreds of protective equipment for the healthcare personnel, I doubt if we really have an outbreak that comes, how are we going to contain it?
That's the major question.
That's the major question. But I cannot really say much about that because I don't know the details of the campaigns that our Ministry of Health is putting in place. But what I will always suggest is, always think of the safety of the healthcare personnel first. When the healthcare personnel know they are safe, they will be motivated to work. If an outbreak reaches us and the healthcare personnel are not motivated to work, it is going to spread very, very wide. So I think getting a lot of protective equipment, and also I think the ministry have been trying to do some courses or some, what should I say, conferences for healthcare personnel or workshop on the Ebola virus. The healthcare personnel really, really do need that. And you know, these workshops, they are not to be organized in Yaoundé. You understand? Into the suburbs, the borders. I mean, if Ebola needs to
can easily get into the country.
Those people at the borders, the healthcare personnel at the borders, they really do need this education more than those who are in the city. Because you know, the border is where people are going to cross in. So you need to be able to make sure that those who are crossing into the country, now if you see some airports, you have this thermometer that they try to pick up your temperature,
yes.
all these check things at the airport and at the borders. You know, our borders are also very porous, we are very open, because we are also very friendly. You know, when you're too friendly, it also comes with a challenge.
You receive
whatever comes in. So we do pray that Ebola does not reach us. And I hope that it doesn't reach us. And even if it reaches us someday, I just hope that our ministry will be able to put in place all necessary measures to make sure that it is well contained and doesn't spread like wildfire.
All right. We are really grateful to have had you in the program today, Mr. KENJI OBADIA. We remember you have a master's in public health and you are currently undergoing a PhD in global infectious diseases.
That's correct.
At the University of Hawaii in USA.
That's correct.
Thank you very much to have been on the program. But before we leave, what last words do you have for the victims and even for Cameroonians out there? We know the disease is not yet in Cameroon. There's no reported case as of now. The Lakentini issue, as you said, was just a bluff. So what do you really have to say to them? Because the people need to hear more from people like you, health operators in this sector.
Well, for the victims, I cannot say much now because I'm not sure they will watch this program. Because when you're a victim of Ebola or when you're sick of Ebola, you're in intensive care unit. And I'm not sure you're able to forget a program like this. But all I would say to them is that let's continue to pray for the victims so that God can always intervene. And let's continue to pray and so that God can give knowledge to the scientists to come up with vaccines, to come up with good medication that is safe and well tolerable. Now, for Cameroonians, what I would say is that wash your hands regularly with soap and running water. You know, I attended a 1 hour talk and the title was Wash Your Hands.
1 hour?
Yeah, 1 hour, just wash your hands.
Okay.
It was not like only showing us how to wash hands, but also infectious diseases that you could prevent by just washing your hands. I've also tried that at some time. I just finished doing all my activities of the day. I just put my fingers in the culture media. I incubated it overnight and was really surprised on the number of bacteria that grow in that culture media as well. So it is always good not only to wash your hands, but wash your hands well. I mean, we are always fun, probably when we go to an occasion, or probably we'll go out in the evening to eat fish, you know, they just bring water in the bowl. I just wash my hands inside and pass it over to you.
The next person.
You know, what we are doing is that we are also, in as much as we are distributing the fish among ourselves to you, we are also distributing the bacteria among ourselves. So it's good to wash your hands properly. What do I mean by washing your hands properly? Use soap and water. And the water should be running, alright? You can use running tap water, or another person can pour water in a jar to pour in your hands. And don't just do this, you know, we are always fond of, they just bring water and you just, I don't know if it's a style or it's a dress or what. It's like you don't really want to wash your hands or you're just trying to put up something, I don't know. This is very important for our health. We want to wash your hands, alright? To know if you actually wash your hands appropriately, try this, sing the happy birthday song. Alright, once that person has poured water and you've applied soap on it, happy birthday to me,
end.
Happy birthday to me, happy birthday, happy birthday, happy birthday to me. You rinse it, then you wipe with a clean towel or with a half napkin. Then you'll really say at least you've washed your hands. Make sure that if there is any person who is presenting with fever, don't just sit and think that is the normal malaria that we used to have. Ebola in its early phase mimics illnesses like malaria, typhoid, leptospirosis, shigellosis, and all the like. So unlike before, where you used to sit in the house for 7 days having fever, you are just in the house, please don't do that anymore. If you have fever one day, please rush to the hospital and try to consult, because the healthcare personnel will want to pick out any person who is infected as soon as possible so that they can isolate the person. Now, how do you know if you have Ebola? It's very difficult to look at somebody on the face during the early phase and say that you have Ebola. But during the later phase, it could be clear-cut because you have bleeding from the nose, bleeding from the ear, bleeding even from the anus. So those are clear-cut signs that you can see. But during the early phase, there is fever, there is headache, There is vomiting, there is diarrhea, there is joint pain, muscle pain, and those are signs and symptoms that are common with other diseases. So let's be conscious, let's be health conscious, especially during this time that Central Africa is facing the worst outbreak of Ebola.
Alright, dear viewers, you've heard it all from no other than a health personnel. Be cautious, be conscious, and most especially, practice all your hygiene and sanitation methods. Wash your hands, cook your meat, your pork meat, whatever you want to eat, cook it very well in order to be able to kill the disease. Thank you for watching. Stay tuned to much more exciting and entertaining programs on CMTV.